Hello, I'm Montse Alvarado, and this is EWTN News In Depth.
The COVID pandemic, in a sense, has inflamed a lot of passions, caused a lot of frustration, a lot of impatience. And so the vaccine issue is kind of crystallizing a lot of that.
The federal government gets aggressive about COVID vaccination requirements, sparking heated debate about what's legal, what's moral, and what should or should not be mandated. As vaccine mandates sweep the country, requests for religious exemptions grow. We'll explain. The Pope warns against using religion for partisan political ends as he completes visits to the nations of Hungary and Slovakia.
But our presence in the Holy Land is from 1848.
Wow.
And the Sisters of St. Joseph of the Apparition fulfill their mission at a hospital in Israel. We'll take you inside a sea of peace in a land divided. EWTN News In Depth is next.
The Labor Department is working on an emergency rule to require all employers with 100 or more workers to ensure their workers are fully vaccinated and regularly tested.
This week, President Biden met with some of the biggest CEOs in the country, including Walgreens, Microsoft, and Disney, to name a few, as part of his vaccine mandate push. Welcome to EWTN News In Depth. The president's meeting comes less than a week after his vaccine requirement announcement that will impact 100 million workers, including most federal employees, healthcare workers, and companies with 100 employees or more. Some 54% of the U.S. population has already been fully vaccinated against COVID-19, according to the Centers for Disease Control and Prevention. Pope Francis remarked on the importance of vaccines this week.
La humanità ha una storia.
It's kind of strange because humanity has a history of friendship with vaccines. When we were children, we had the measles and other vaccines, polio, and nobody protested.
On the plane home from his trip to Slovakia, the Holy Father said he didn't understand why people refused to take the COVID vaccine and noted that even in the College of Cardinals, there are skeptics of the vaccine. The controversial move of mandating the vaccine is stirring debate across the country and within the Catholic Church. There have been varying reactions from Catholic leaders, from the Pope down to priests. Mark Irons reports.
As vaccine mandates are coming into effect around the world, some Catholics may have lingering moral concerns about a COVID shot.
Some of these vaccines being either tested or derived from cell culture lines that were originally derived from an aborted fetus. And that gives people pause.
But the Catholic Church says if there are no ethical alternatives, it is morally acceptable to receive such a vaccine. Dr. Paul Carson with the Catholic Medical Association explains in part why.
We're in a global pandemic that is taking hundreds of thousands, if not millions of lives globally. There's a very proportionate reason for trying to do good here.
Joined by archbishops from Latin America, Pope Francis is supporting vaccination.
Cada uno puede aportar su pequeño grano de arena.
In an August video message, the Holy Father said getting the vaccine is an act of love. And the U.S. Conference of Catholic Bishops is giving this guidance to Americans. Given the worldwide suffering that this pandemic is causing, we affirm again that being vaccinated can be an act of charity that serves the common good. Adding, if one has the ability to choose a vaccine, Pfizer or Moderna's vaccines should be chosen over Johnson & Johnson's. The bishops note Pfizer and Moderna used abortion-derived cell lines in testing, but not production, while Johnson & Johnson used them in testing, development, and production. The question still remains, should vaccination be mandated? In December 2020, the Vatican's Congregation for the Doctrine of the Faith released a statement approved by the Pope, in part saying, practical reason makes evident that vaccination is not, as a rule, a moral obligation, and that, therefore, it must be voluntary. But there are differing opinions from church leaders. Bishops in Wisconsin and Colorado have released statements supporting the right to seek a religious exemption, with the Colorado Catholic Conference even providing a template for religious exemptions on their website. The move in Colorado was slammed by Bishop Robert McElroy of San Diego, who asked his priests not to sign exemption letters. Meanwhile, Bishops John Stowe in the Diocese of Lexington and Mark Seitz in the Diocese of El Paso are requiring diocesan employees to be vaccinated. Bishop Seitz says those who work and perform ministries in a special way represent the church. We need to lead by example. Dr. Joseph Meany, president of the National Catholic Bioethics Center, says a vaccine mandate could pressure people into deciding to do something they are conscientiously opposed to.
And of course, what a mandate does is tell people either you do this or some negative consequence comes upon you. It makes it more difficult to actually come to the best possible ethical decision.
The National Catholic Bioethics Center has provided a vaccine exemption template letter on its website, intended for Catholics who have decided to refuse a vaccine. For those who choose not to get vaccinated, Meany is pushing extra precautions.
There are other things that they can do to lessen the risk that they will catch the disease or spread it, in terms of masking, in terms of social distancing, and in terms of, taking a certain amount of precautions.
Meany believes instead of vaccine mandates, frequent testing could be increased. As the COVID fight continues around the world, Dr. Paul Carson is reminded of the human toll the virus is taking. He argues there may be a moral imperative to get the vaccine.
I'm a medical director in a nursing home where I saw this tear through our nursing home last fall and kill many, many of our nursing home residents, despite all of our best efforts to keep it out. And things didn't change until we started vaccinating.
Mark Irons, EWTN News In Depth.
State-level vaccine mandates are nothing new in the United States, and some U.S. leaders are calling President Biden's federal vaccine mandate unprecedented, and they say it's unconstitutional. To help put our history into context and provide insight on the workings of this proposed mandate, we were joined by the author of Choose Your Medicine Freedom of Therapeutic Choice in America, Louis Grossman, professor of law at American University Washington College of Law, on a Zoom call earlier today.
Mr. Grossman, it's so great to have you with us. Thank you for explaining vaccine mandates, which I know has been a topic of great controversy around the country. Can you give us a brief history of vaccine mandates in the U.S.?
Yes, thank you for having me, Montse. Vaccine mandates in the United States go back to the very early years of the United States. The first often cited vaccine mandate was the mandatory smallpox inoculation of the troops under George Washington during the Revolutionary War. As early as the early 19th century, some towns and localities started to mandate vaccination. And by the way, the only name of the game for vaccination until the late 19th century was smallpox. In 1855, Massachusetts became the first state to mandate vaccination for school children as a condition to enter school. And over the course of the decades after that, various states and municipalities adopted smallpox vaccine mandates, sometimes enforced through fines, but more frequently implemented as a condition to attend school. But those were never free of dispute. And there were often big fights about those mandates. And in fact, the state of Utah actually in the 1880s, I believe, passed a law banning vaccine mandates.
What about the military? What is the history of vaccinations in the military and mandates there?
Right, there's never really been much of a dispute that the United States government, through the military, has the authority to mandate vaccination. Following George Washington's smallpox vaccination effort, the first big mandatory vaccination in the US military was a mandatory typhoid vaccination during World War I. Over the years, more and more mandatory vaccines have been added to the list, and it's been really standard practice to require US military, people serving in the US military, to get vaccines.
But this vaccine mandate for the military does also have an exemption, a religious exemption, a medical exemption. Is that a normal thing to see even within the military?
In terms of the military, I mean, there have been some really big controversies in the military where people have objected to mandatory vaccination. For example, after 9/11, there were objections to mandatory vaccination with a experimental anthrax vaccine, and people objected both on grounds of sort of general personal liberty, but also on the grounds of religious exemptions. to taking mandatory vaccinations. And if I remember correctly, the courts pretty uniformly held that there are no religious exemptions for military mandatory vaccinations.
So then when did the federal government get started in regulating medicine, regulating our health?
That's a great question, because it's often mentioned that the regulation of public health is primarily a state function. And indeed, for most of the 19th century, indeed all of the 19th century, it was almost exclusively a state function. There were a few curious exceptions to that where the federal government got involved. Indeed, in 1813, there was something called the Vaccine Act, which got the United States government involved in distributing and ensuring the quality of imported smallpox vaccine. But another interesting thing is the United States government's first big step into medical regulation and medical product regulation concerned vaccines. It was in 1902. It was called the Biologics Control Act, and there were outbreaks of tetanus due to contaminated diphtheria and smallpox vaccines in St. Louis, Missouri, and Camden, New Jersey. And in response to that, the US Congress passed a statute that's still in effect today, which allows the US government to regulate vaccines to ensure their safety and purity and efficacy.
So regulating vaccines is something that's not unprecedented, but is this federal mandate unprecedented? And is it something that the president has the power to do? Is it constitutional?
This is the first time I'm aware of when the federal government has mandated vaccines amongst the civilian resident population this broadly. Whether or not the Biden administration has the authority to do this is a complicated, multi-part problem. First of all, the mandate, although it's most famously or most notoriously in some people's view about mandates, a mandate for vaccines in workplaces with 100 or more employees, the mandate also includes federal employees, federal contractors, and healthcare workers in Medicare and Medicaid funded healthcare facilities. And I think the first two of those are less vulnerable to attack than the workplace one. The workplace one is being done pursuant to a statute called the Occupational Safety and Health Act, passed in 1970. And there's a couple of questions that you have to ask whenever the federal government imposes something pursuant to a federal statute. The first question is whether Congress had the authority to pass the statute in the first place. And that's indisputable here because OSHA doesn't say anything about vaccines, it's just workplace safety. But then there's always the second complicated question of whether the executive branch of the government, that is the president and the agencies, have the authority under that statute to do what they are doing. And that is a much more controversial and vulnerable thing here, because OSHA doesn't say anything about vaccines in particular. Moreover, the Biden administration has done this pursuant to a special provision called emergency temporary standards.
Right.
And there's a whole bunch of very specific statutory requirements to issue such a standard. It's not the first time it's been done. The Reagan administration issued such a standard with respect to asbestos, but it is subject to dispute from the perspective of what we call administrative law. That
Right.
does the agency and the president actually have the power under the statute to do it?
Louis, one last question, just a general one. Does the government actually have the power to mandate every American to get a vaccine?
So you're referring there, I assume, to the federal government, and that is a very, very complicated question. From a constitutional perspective, with regard to rights, there's a case called Jacobson v. Massachusetts from 1905, which almost certainly allows mandatory vaccination, whether it is issued by the state or the federal government. But the question of whether the federal government constitutionally has the power to mandate vaccines nationwide is a much more complicated thing, and they probably don't. And they probably don't for both constitutional reasons and for and if the question is whether the Biden administration could do so now for statutory reasons. First of all, does the federal government have the power to require everybody to engage in commerce by taking a particular product? That was called into question by the famous Affordable Care Act case from earlier in this century.
Right.
Moreover, there is a statute, a very broad statute, that allows the federal government to do anything it deems necessary to prevent the spread of communicable disease. That is the statute that was used to implement the eviction moratorium, if you remember that this summer. But the Supreme Court ultimately said that that was beyond the power of the executive branch under the meaning of that statute. And there is a question as to whether or not that particular provision could be read to permit mandatory vaccination of all Americans. It goes to the language of the statute itself and judicial interpretation of it. So that's a great question. But my bottom line is the federal power to mandate that everyone get a vaccine is questionable enough from both a constitutional and statutory perspective that I do not expect the Biden administration to be doing anything like that soon.
Well, we'll be watching it closely. We know we have some cases going up through the courts right now, one specifically in New York that we'll be talking about. So thank you so much for being with us, and hopefully you'll come back to continue explaining this important issue.
It was a real pleasure. Thank you for having me.
Despite a history of required vaccinations in the U.S., the country remains divided about the COVID vaccine. Up next, the rise in lawsuits and use of religious exemptions to block unwanted mandates. We're joined by a lawyer defending a group of medical professionals who say no. EWTN News In Depth. We'll be right back.
It's not easy. It is tough. It is tiring. It's it's discouraging sometimes, but finally, it's giving strength by the Lord, grace.
And later, an oasis of no conflict in the middle of a conflict zone. We travel to Jerusalem for an inspirational visit with a religious order embracing people of all religions. Welcome back to EWTN News In Depth. I'm Montse Alvarado. The debate over the vaccine mandate announced by President Biden last week continues to draw criticism from both sides of the aisle, including those who say it contradicts their religious beliefs. Many of them are hoping to claim religious exemptions not to take the vaccine. They fall into a broader category of exemptions to any law, including medical, moral, and secular. Clergy from several denominations are offering exemption letters to help parishioners. The legal standard for religious exemptions is complicated and is already being challenged in the courts. The debate revolves around the following. The exemption must be based on sincerely held religious beliefs. The Labor Department says employers may refuse an accommodation if unvaccinated workers put an undue burden on the employer's business. But experts say these exemptions are tricky. How does an employer determine whether it's a sincerely held religious belief or something being used by an employee who is generally opposed to vaccinations? Is that up to the courts? Catholic dioceses that employ more than 100 people in the U.S. will not be exempt from employer vaccine mandates, just like other employers subject to OSHA regulations. As we reported earlier in this program, there are many dioceses requiring vaccinations for their staff, issuing those requirements before the president's announcement. The state of Arizona has become the first to file a lawsuit against the president's vaccine requirements. Arizona's Attorney General Mark Brnovich argues the requirements are unconstitutional and discriminate against U.S. citizens because, quote, migrants who cross the southern border illegally are not subject to any vaccination requirements, which he calls unconstitutional and a brand of favoritism in favor of illegal migrants. In New York, 17 Catholic and Baptist medical professionals filed a lawsuit against the state for vaccine mandates based on religious reasons. The lawsuit says the mandate overrides protections under the Civil Rights Act of 1964 and the First and 14th Amendments. A federal judge has now temporarily blocked the state of New York from forcing medical workers to be vaccinated. The state has until September 22nd to respond to the lawsuit. We reached out to the Attorney General of New York, Letitia James, as well as the New York Department of Health to discuss this on EWTN News In Depth, but they declined to comment. We received a statement from New York Governor Hochul's press secretary, Hazel Crampton, who says that the order does not suspend the mandate, but temporarily bars the Department of Health from enforcing it on those who claim a religious exemption. Attorney Steve Crampton, senior counsel at the Thomas More Society, who represents the plaintiffs in this case, did agree to come on our show to explain a little more about it. Steve, what are the claims that your clients, medical professionals, are making?
Essentially, we're making three claims here. First, that the public health order in effect right here is a violation of the Supremacy Clause of the United States Constitution because it disregards not only state law, but federal statutory law and the Constitution itself. States can't do that. Second, we're claiming a violation of the Free Exercise Clause because this regulation is neither neutral nor generally applicable and does not meet the strict scrutiny analysis that the case law requires. Third, we're claiming a violation of the Equal Protection Clause of the 14th Amendment because this regulation singles out, in effect, folks that have a religious objection to the vaccine, which is the case for our 17 plaintiffs, and treats them differently from, for example, people that have a medical issue with regard to the vaccine. We don't even get to make an application for a religious exemption under the regulations as currently structured. So that's it in a nutshell.
Basically, what you're saying is if the government in any way exempts anyone, it has to also exempt religious people. And that's why you have a claim here and why the court responded to you. Let's take a step back, though. Are you just trying to knock down all vaccine mandates altogether, or is this really only about religious exemptions?
Yeah, absolutely not. This is simply a modest request that the state of New York recognize and respect, as federal law requires and as the law of the state of New York requires, a genuine, sincere religious objection to a mandate such as this vaccine mandate. And it doesn't even guarantee, our lawsuit wouldn't guarantee that our clients would all obtain that religious exemption, but it would respect the right to apply for one. That's all we're asking here.
For the right to try. And so this is about the state of New York and not about the federal mandate that we're waiting to be issued through the Department of Labor. So then what's next in the lawsuit? The government has to prove that there's no other way for them to eradicate COVID other than issuing a mandate. This is the state government of New York that forces people to violate their conscience. Is that what's next?
That's it in a nutshell. What we have is a deadline for the state to respond by September 22, which is next Wednesday. Then there's a hearing, if necessary, if the state persists, which it looks like they will in its position, set for September the 28th, the morning of the 28th.
And so you'll be in
So
court.
we're moving fast. Yes.
Moving quickly. Do you see any other lawsuits similar to this that will be coming up? Are you planning on bringing other cases?
Well, yes, we're being contacted, of course, all over the country. Other firms are involved as well. As you may know, there's another lawsuit similar to this one pending in the Eastern District of New York, also awaiting a hearing. And as you say, the federal mandate is yet to be kind of spelled out for us, but we're looking very closely at that, too. Frankly, it's a time in our nation like no other time, I think, with regard to the threats to our fundamental freedoms. And we're active and looking very carefully, as I say, all across the country at these things.
And with the federal mandate coming out, it does seem like it might have religious exemptions since the military and a couple of other places have received exemptions from it. Are you curious to see if there will be one included there? Is there anything you're doing to promote that?
Well, yeah, we're very curious. And, given the kind of almost testing of the waters that New York has undertaken here, the state of Maine has also tried this kind of absurdity of setting aside all religious exemptions. Very disturbing incremental suggestions here that we're in danger of losing just all of our fundamental freedoms. So when the federal government and the White House itself is disrespecting, frankly, throwing all kinds of insults at the unvaccinated, it is a trend that we are watching very carefully, and we think bodes real ill for what's coming. We're in danger of moving from a free America to what looks like a kind of clone to Red China here.
Well, we'll be watching that closely. Thank you so much.
Thank you. Appreciate it.
Still to come, Catholic churches being vandalized. The alarming number of attacks being reported in the U.S.
It's not easy, it is tough, it is tiring, it's discouraging sometimes, but finally, it's giving strength by the Lord's grace.
And later, an oasis of no conflict in the middle of a conflict zone. We travel to Jerusalem for an inspirational visit with a religious order, embracing people of all religions.
L'applauso lo hanno incominciato le suore, che sono vittime delle nostre omelie.
Pope Francis sparking laughter while addressing Slovakian Catholic Church representatives in Bratislava. He told clerics that many homilies were boring and too long. He urged priests to keep homilies to 10 minutes and take inspiration from the Bible to connect with parishioners. The Pope's visit to Slovakia was packed with many messages for the clergy and for the faithful. He met with thousands of young people, visited a Roma community, and celebrated Mass. To give us a better understanding of the impact his pilgrimage to Slovakia had, I spoke with senior Rome correspondent for Catholic News Agency, Hannah Brockhouse. Hannah, thank you for joining us today from Reggio Calabria, Italy. The Pope celebrated the Byzantine Rite Divine Liturgy in Slovakia, and we know Slovakia is primarily a Christian country, but almost half are Catholic there, and a very small percentage are Byzantine. How does this Mass impact unity in the Church and the country?
Well, you're exactly right that Pope Francis celebrated this Byzantine Divine Liturgy for just a small percentage of the Catholics in the country, since most Catholics are Roman Catholic. And he spoke about the theme of unity, not only there, but also in other meetings, and about Catholics in the country working together. It was interesting that Pope Francis went there. Also, several other places he went during his trip were significant. Obviously, we know Pope Francis likes to visit the peripheries. He likes to visit the marginalized, the minority communities, and he did that on this trip. One other significant thing to know is there's a place he didn't go. Someplace John Paul II went on his visits to Slovakia is the city of Nitra, which is very important for Catholic history in Europe. And so his choice also to avoid that popular spot, instead choosing more places on the eastern side of the country, which is also a poorer area, less developed, I think is also very significant.
We'll get to the issue of the marginalized in a second, but let's talk about young people. The Pope had a message for the young people of Slovakia about courage, rejecting the culture of the ephemeral, and giving of yourself without half measures. And my favorite part, recognizing the usefulness of shame to signal we need a new path, but not letting guilt silence us from speaking the truth. How is this message specific to the people of Slovakia?
Well, obviously, they have a very difficult history when it comes to communism and the Catholic Church in the country. And so I saw the Pope really calling young people here to a renewed faithfulness. They're Catholic majority, but obviously we all have room to grow in our faithfulness, the depth of our relationship to Jesus Christ. He spoke a lot about the sacrament of confession, and it was obvious he wanted to give this message about renewal.
One of the most memorable moments of his trip was when he visited with the Roma people, who, as you mentioned, are often discriminated against and suffer from racism across Europe. And he urged them to integrate into Slovakia and not segregate themselves despite the barriers that they face. How do you think this message was received, and why was it important?
Well, honestly, it was very surprising. I heard from Slovakians, it was even surprising that the Pope chose to go to visit the Roma in this, in their neighborhood where they live. That was already a surprising choice. And by that alone, he was showing this message of unity, of defense of the vulnerable, of the more weak. I think the meeting was well received, but obviously not necessarily a popular decision by the Pope.
And Hannah, we introduced this segment of our show with the Pope's joke with the clergy, that their homilies are too long and maybe a little boring. But connecting with the faithful is incredibly important. What was their reaction?
Well, obviously, everyone had a good chuckle at the Pope's jokes, and people have been talking about what he said about, homilies no more than 10 to 15 minutes. But I think it's important to notice what else he said about homilies, that they also should be based on the scriptures, that they should apply to people's lives. And he said, they should be short unless they're very engaging. So I think there's some room there for those who are very dynamic preachers. But then he tied that into, obviously, spreading the gospel. So we have the homily, the preaching at Mass, which priests do, but then tying that to the baptismal call of every Catholic to spread the gospel. And he really did that on this trip, encouraging Slovak Catholics to continue to spread the faith and to stay firm in their Catholic roots.
So a request for renewal in our interior life, but also in the way that we share the gospel. That's great to hear. Hannah, we're so grateful that you are there to give us this analysis, and we look forward to staying in touch.
Absolutely. Thank you.
Thank you. During the closing Mass, the Holy Father said there are 3 steps to renew ourselves as disciples: proclaiming Jesus, discerning Jesus, and following Jesus. Joining us on set after returning from hosting extended coverage of the International Eucharistic Congress in Hungary is executive editor of EWTN News and Washington Bureau Chief, Dr. Matthew Bunson. Matthew, it's so great to have you here.
Great to be with you.
It was wonderful watching all of the exciting coverage. I don't know how you're not exhausted. I do want to talk about the impact of the papal visits. The Pope has been traveling extensively, and Cardinal Sacco mentioned how it impacted Iraq so profoundly to have the Pope there. Do you think this is going to have the same impact in Hungary?
Yeah, every papal trip brings something different. Every papal trip has its own forms of influence. And in this case, Pope Francis's very brief visit, only about 7 hours to Hungary, had a very specific purpose, and that was to close this International Eucharistic Congress. In that sense, it was tightly aimed by Pope Francis. As with any papal trip, of course, he also met with leaders, civil government, and also ecclesiastical. We can talk more about that in a minute. But his focus on the Eucharist, as you mentioned in his closing homily, was a capstone to what was a wider week of the International Eucharistic Congress. So we have to put that together, that entire experience of the Congress, and Pope Francis was the punctuation mark, the exclamation mark on the week.
So let's talk about the civil leaders then. Pope Francis did meet with Viktor Orban and with János Éder. And János being Catholic himself, Viktor being Calvinist. There were things they did not discuss, like immigration,
right,
but things they did discuss where they did want to come together. What were those?
Well, János Éder was especially notable in the Eucharistic Congress because his testimony during the Congress was unabashedly Catholic. He also quoted Laudato Si, which
picked it up
and held it up for everyone to see. But that goes to part of the conversation that Viktor Orban and Pope Francis had, and that was looking at the environment. But they also had one other area of key common ground, and that is family life. Pope Francis, in his in-flight presser going back from Slovakia to the Vatican, stressed matrimony. He stressed marriage, the importance of family life. And life. So those are areas of deep common ground. You interviewed Katalin Novak, one of the representatives of the Hungarian government, last week, and she was stressing that importance of family life.
Yes.
And then one other area that wasn't really much discussed, but is of common ground, is the great concern that the Hungarian government has for persecuted Christians around the world, that they have a separate ministry looking into that. So there was common ground, but yes, there were some areas of disagreement.
And the common ground also included Eucharistic revival. Can you tell us a little bit more about that?
Yeah, well, any Eucharistic Congress has as its goal to deepen our awareness and love of the real presence of the Eucharist, and then to carry that forward. That was one of the points that Pope Francis was making. In the streets of Budapest, we had a Eucharistic procession the night before the final Mass with the Pope about 150,000 people stretching from the parliament, which is situated right there on the Danube, all the way to Hero Square, where the final mass was held. This was a spectacle that Hungary had not seen for a long time, but it was a kind of public witness that many in a secularizing Europe would say is simply not possible anymore, that there just wouldn't be that much interest. Clearly, there was intense interest, and it goes back to this idea of preserving and advancing a Christian culture, a Christian civilization in Hungary that can then help re-evangelize Western Europe. And the Eucharistic Congress has a role to play in that.
Absolutely. And part of that Christian culture is reaching out to the marginalized. So in Hungary, we saw outreach to the Roma people, and then we saw it again in Slovakia. Tell us about that.
Well, in the Eucharistic Congress, there was the highly unusual event of a mass set in Livonian, which is the language of the Roma in Hungary. That was somewhat unprecedented. It was a gorgeous mass for anyone who was actually watching it. But it was also part and parcel of the concern that Pope Francis brings, but also that the Hungarian Catholic Church brings, and that we're seeing also in the Slovak Catholic community, of this worry and concern for the marginalized, for minority groups, especially the Roma, who have over the centuries been so persecuted. So it fits perfectly both within the concern pastorally of Pope Francis, but also what the Eucharist is calling us to do, and that is to be a sacrament of unity, to bring everyone in the church who might have been forgotten over the centuries.
Well, we've been watching Pope Francis go from country to country trying to bring people together, and so this is very much part and parcel of that mission, and we're going to watch that closely. Thank you, Matthew.
Great to be with you.
Don't forget to follow EWTN News In Depth social media channels. We have some behind-the-scenes photos of the International Eucharistic Congress on our Facebook, Twitter, and Instagram pages.
They had legal, legitimate evidence of child abuse and did nothing. If they're not going to protect me, I want to know, who are they trying to protect?
Emotional testimony on Capitol Hill as 4 Olympic gymnasts point the finger at the FBI. They want answers as to why one man was allowed to continue abusing scores of young girls despite reports to law enforcement. And Pope Francis takes the question, should pro-abortion politicians be permitted to receive communion? His reply and more coming up in the Week in Review.
America enters an unfamiliar medical landscape as spiking COVID cases and packed hospitals lead to healthcare rationing. That story tops the Week in Review. The state of Idaho became the latest to announce healthcare rationing amid a massive increase in the number of COVID patients requiring hospitalizations. The Idaho Department of Health and Welfare said the state has entered crisis standards of care because COVID patients have exhausted the state's medical resources. That means medical personnel must decide which patients get the most intensive treatment based on who they think is most likely to survive. Patients receiving lesser care will be given pain relief. That applies to both COVID patients and ones seeking medical treatment for accidents, heart attacks, or other illnesses. Idaho is one of the least vaccinated states in the country, with only 40% of its residents fully vaccinated. New data released by COVID-19 vaccine maker Moderna suggests that people vaccinated last year are 2 times more likely to get COVID-19 than those vaccinated more recently. The study found that those who were vaccinated earlier had a 50% higher rate of symptomatic breakthrough cases. The data does suggest that the vaccine is effective in preventing serious health issues or death from variants of concern, but does show that efficacy decreases over time. Moderna CEO says the study supports the need for a booster shot. Emotional testimony this week on Capitol Hill as 4 Olympic gymnasts testified about a botched FBI investigation into wide-ranging sexual abuse at the hands of USA Gymnastics national team doctor Larry Nassar.
To be clear, I blame Larry Nassar, and I also blame an entire system that enabled and perpetrated his abuse. USA Gymnastics and the United States Olympic and Paralympic Committee knew that I was abused by their official team doctor long before I was ever made aware of their knowledge.
Nasser abused hundreds of athletes over a period of years in what is described as the largest case of sexual abuse in the history of American sport. He was convicted on child pornography charges in 2018 and is currently serving a 60-year prison term. During a hearing before the Senate Judiciary Committee, Simone Biles and other gymnasts demanded accountability from the FBI for massive failures in investigating the case. The Department of Justice found FBI agents in charge of the case delayed investigating allegations, were often dismissive of the victims' concerns, and lied about it when they came under scrutiny. Christopher Wray, who became FBI director after that conduct, publicly apologized to the victims and pledged to make significant changes in the future. An alarming number of attacks on Catholic churches in dozens of states across the nation, according to the U.S. States Conference of Catholic Bishops. At least 95 churches have been targeted since May of 2020. More than 40 reports of attacks this year alone. Incidents include arson, statues beheaded or smashed, parishes vandalized with graffiti and broken windows, and more. The USCCB's Committee on Domestic Justice and Human Development issued a statement in response, saying, "As we strain to understand the destruction of these holy symbols of selfless love and devotion, we pray for any who have caused it, and we remain vigilant against more of it." Pope Francis spoke out this week against political influence on the clergy's pastoral duties. As he returned from his visit to Slovakia, a reporter on the papal plane asked the pontiff if President Biden and other politicians should be denied communion because of their stance on abortion. The Pope said bishops should minister to such politicians with compassion and tenderness and not condemnation. He said that abortion is homicide. Yet he emphasized communion is not a prize for the perfect. Though he did not give a yes or a no answer, it's the closest he has come to directly commenting on the Biden communion question. Steps toward sainthood. The revered Polish Catholic figures Cardinal Stefan Wyszynski and Mother Elizabeta Rozadzaka were beatified this week. A Vatican cardinal declared the two towering figures of the 20th century blessed at Mass in Warsaw. A congregation of nearly 7,000 people attended the event, with people seated inside and outside the Temple of Divine Providence. 80 bishops from Poland, 45 from abroad, and 600 priests took part in the celebration. Mother Elżbieta Rozadzaka was born into aristocracy in present-day Ukraine and lost her sight at 22 years old. A doctor advised her to dedicate her life to serving the blind in Poland after medical efforts failed to restore her vision. She founded the Society for the Care for the Blind, as well as the Congregation of the Franciscan Sister Servants of the Cross, and adapted the Braille alphabet to the Polish language. An 18-year-old credits Mother Elżbieta Rozadzaka with her recovery from a devastating accident. Cardinal Stefan Wyszynski met Shaka in 1926 and during the Warsaw Uprising in 1944. The two helped organize a field hospital for the wounded in Laski, Poland. After the war, Cardinal Wyszynski was named Archbishop of Gniezno and Warsaw, becoming the primate of Poland. In 1953, he was placed under house arrest after he refused to subordinate the church to the communist authorities. He's also known as the Primate of the Millennium because he oversaw a 9-year program preparing a nationwide celebration of Poland's baptism in 1966. You can read more about these two blessed figures on our sisters organization website, CatholicNewsAgency.com. Why the Polish Parliament declared this year, 2021, the year of Cardinal Stefan Wyszynski.
If America wants to reclaim the power and the appeal of that founding vision of E Pluribus Unum, well, then it's going to need us. It will need the church.
Bishop Stephen Lopez urged Catholics to strive for unity as the 2021 keynote speaker of the National Catholic Prayer Breakfast this week. Speaking to a room of hundreds of Catholics, the bishop says people of faith are needed in the civil realm for many pertinent reasons. To pose necessary questions about human dignity, the goodness of human order, and to bear witness to Jesus Christ, so that we remind society that we need God in order to keep our society truly free and just. He was one of several prominent speakers at the annual breakfast. Bishop Lopez heads the personal ordinariate of the Chair of St. Peter that is designed to reach out to those raised in the Anglican tradition.
We have Jewish patients, Muslim patients, Christian patients, to let them really go to the Lord peacefully and with serenity.
Inside a hospital in the Holy Land, where compassion is woven across many faiths. The long history of a religious order and its mission of mercy when we return.
and now, promoting compassion and human dignity in a region of constant religious tension and conflict. Muslims, Christians, and Jews peacefully coexist within the walls of one hospital in Jerusalem, thanks to a Catholic religious order that's been serving people in need there for more than a century. Colin Flynn reports from Israel.
At the edge of the old city of Jerusalem in the Holy Land, there is a hospital, the St. Louis French Hospital, run by the Sisters of St. Joseph of the Apparition. And inside the hospital is a beautiful church. This is Sister Frida Nasser.
This is the church of the hospital. Of course, in the middle is the Blessed Sacrament. And if you look around, you can see that it is an historical place. We have here St. Louis. The hospital is dedicated to St. Louis, and it's very beautiful.
Sister Frida is the provincial superior of the Sisters of St. Joseph of the Apparition. She walks the corridors of the different departments, and the patients feel comfortable talking to her. She speaks fluent French, Italian, English, and Arabic.
Aujourd'hui, j'ai eu un supplémentaire et je dis ça pour Zina. كيفك؟ شو أخبارك؟ كيف أمورك سارة؟ كيفك؟ أهلين أهلين.
Sister, how many years have you been here? The sisters been here in this hospital?
In this hospital, as in 1882 we started, but our presence in the Holy Land is from 1848.
Wow. The Sisters of St. Joseph of the Apparition were founded on Christmas night in France in 1832. They arrived and started their work in the Holy Land in 1848. And when they arrived, the two major needs they noticed the people had were healthcare and education. So they answered the needs of the people. The hospital they built here in Jerusalem was originally built in the old city within the Latin Patriarch. It was a small 3-room hospital, and they soon outgrew this, and a bigger hospital was built just outside the walls of the old city, opposite the new gate.
Now we are coming up to the hospital. It is in 3 sections: palliative care, elderly people, and palliative care with some treatment. So we are specialized for the last stage of life.
Can it be difficult sometimes? You know, there's so much division here and conflict, and inside the hospital, of course, you're trying to heal.
Look, inside the hospital, we don't feel it. But when you are outside the hospital, you feel it. I can tell you from my experience in the schools, for example, we can feel it a lot with the students. It's very tense, really tense. The situation is tense. But inside this hospital, I can assure you that we don't feel anything, and we don't speak about politics. We try human being only here, we treat. Who help? He is helping you. Nice.
The hospital can hold 100 patients, most of whom are in the final stages of life. And for many of these patients, they grew up in the face of conflict and division. And so the sisters devote special care, love, and attention to them. Heskel Garour is from Iraq, but has been living in Jerusalem for 70 years. He's been in hospital now for 5 months.
Why did I come here?
Yeah.
Because I have cancer and I have no home.
Okay. You've cancer in your chest?
Yes.
Okay, I'm sorry to hear that.
Never mind, everything passed. Even life.
Life is life, I know, but how do you feel?
Fine.
You feel okay?
Good.
Yeah.
I don't think about it.
You don't think about it?
No.
Why not?
Why should I? Why?
What will be, will be.
Yes, sure. It's not in my hand. It's nothing I can help.
It's in the hands of God.
Yes.
Yeah. And you are Jewish?
Yes.
Yes. And you share your room here?
Yes. And he's Christian.
While outside the hospital walls, there is a great division between people of different faiths, the sisters have insisted on caring for those of all faiths.
We have Jewish patients, Muslim patients, Christian patients, to let them really go to the Lord peacefully and with serenity.
I don't have anything just to have sisters give me place, give me
Maspan Amro is from Ethiopia and is Christian. He's been here under the care of the sisters for 10 years after a disease left his legs partially paralyzed.
Different religions. We have Jewish people, we have Christian, Catholic, Greek Orthodox. I like all here in the hospital. It's very beautiful. It's like my home.
To pass the time, Maspan loves to play the piano and paint. This painting displays symbols of Christianity, Judaism, and Islam.
So I'm going to show the social worker. Yes, Father says.
Where do you see Jesus in the work that you and the sisters do here?
You know, our founder is Saint Emily de Vialar. She is the French lady, and when she founded the congregation, is to come to help people they are in need, suffering. So whatever we do is for the glory of God and for the good of the others, as if we are seeing Jesus in all these people.
How many years have you been a sister?
Already 40 years.
40 years?
Yes.
Congratulations. Do you still have that fire and passion?
I think yes, because of course it's not easy, it is tough, it is tiring, it's it's discouraging sometimes, but finally it's giving strength by the Lord grace. Yeah, it's nice, it's a mission for us.
In Jerusalem, Colm Flynn, EWTN News in Depth.
Christ's love shining through to all of his people. As we say goodbye, another look at the Pope's trip to Slovakia and the many evocative images from his apostolic visit. I'm Montse Alvarado. Thank you for joining us this week. We hope to see you again next time for more conversations about what matters to our Catholic life. Now, enjoy our images of the week.
Vittime delle nostre omelie